and thank you for being with us for today's COVID-19 update for February 3, 2022. Dr. Anthony, let's begin today's update with the number of active cases currently.
Well, good day to you and to your viewers and listeners. First of all, let me say that we have noticed a trend where we were seeing a drop in the cases. So right now we have 8,104 cases as compared with last week when we were up to about 13,000 cases. New cases over the last 24 hours would have been about 291. And again, we're expecting this to come down a bit as we get out of the Omicron wave. In addition to that, we have seen a decline in hospitalizations. Right now, we have 136 persons in hospital, with 89 of them at the Ocean View Hospital. We have 9 pregnant women who are at the Georgetown Public Hospital with COVID, and we have 11 persons who are in the ICU.
Okay. Any recorded deaths in the last 24 hours?
Fortunately, we did not have any deaths over the last 24 hours. But again, the 11 patients that we have in the ICU, they are critical, and therefore we'll have to continue to monitor them. Unfortunately, the other trend that we have noticed is that a lot of people who are coming into the hospital, they're either unvaccinated or partially vaccinated. And because of that, they would not get the kind of protection that they need if they are going to fight off COVID-19. So this is a good time to remind people the rationale and the reasons why they should get vaccinated.
Okay. Could you now give us the vaccination update?
So in terms of vaccines, in terms of the adults, we have 425,333 persons who receive a first dose vaccine. That's about 82.9% of our adult population. Second dose, we have 315,909. That's about 61.6% of our adult population. And for persons between 12 to 17, first dose is 32,749, or 44.9% of that age cohort. And second dose is 23,213, or 31.8% of that age cohort. Booster doses have been going up incrementally. We have done now 41,091 doses. And so this is an area we have to keep working on.
Okay. Thank you, Dr. Anthony. And here's a question. Denmark has lifted all COVID-19 restrictions, with the coronavirus no longer considered a socially critical sickness. How far more do you think Ghana need to go before we can do the same?
Well, in the case of Denmark, they have very high levels of vaccination. And in fact, when you look at the statistics from Denmark, you would see that persons 5 years and over, their vaccination rates are somewhere in the 80% range. And that's for both first and second dose, and I think their booster doses are close to 60%. So they have a different epidemiological situation. So although they have cases, the high level of vaccination rates are going to give that population good levels of protection. We don't have the same here because the numbers that I just told you, we are still lagging behind in terms of the booster doses. We are still having a lot of people who are partially vaccinated and they have not come to get both doses of their vaccines. And then, of course, we still have to access vaccines for children between 5 to 11. These vaccines are not immediately available, but we are working to make sure that we can get them.
Okay, Dr. Anthony, we've also seen some countries making COVID-19 vaccines compulsory. What are your thoughts on this?
I think each country would have to decide what is the appropriate strategy for the particular situation. In Guyana, we have decided not to do so, but we are encouraging people to get vaccinated. We have offered these vaccines for persons 12 years and over, and we want to encourage everyone to make sure that they get vaccinated. We are currently working on accessing the 11 to 5, and you would also notice that on Tuesday, Pfizer would have submitted to the FDA in the US for permission to get a vaccine that would be for children between 6 months and 5 years. Hopefully that would be approved by sometime by the end of this month. And once that is approved, they will start using that vaccine. We, of course, we're trying to access these vaccines. A lot of the developed countries would have paid in advance for these vaccines, and therefore it is always a challenge to get them. But nevertheless, we have been making some strident efforts in trying to get vaccines for children between 11 and 5. In the meantime, however, there is still a gap, I would say, where people who they haven't come forward to get their first dose. We still need to close that gap. There are persons who have received one dose and they didn't come back for a second dose, so we need to address that as well. And then thirdly, there are people who haven't, while they're eligible for their booster shots, have not come forward to get the booster. So we need to work on that and make sure that people understand the importance of getting vaccinated.
Okay, Dr. Anthony, here's a final question, one from the newsroom. In January, you said the Health Ministry would investigate the deaths of some children who succumbed to COVID-19. Has that investigation been completed? And if yes, what were the findings?
So there's a team that is working on that. There are 3 persons, persons from the ministry and persons from the Georgetown Hospital who have undertaken that investigation. So they have been looking at the charts and examining the signs and symptoms, and they're yet to make conclusions on how we can improve this. As you can recall, at the time we had, I think, about 4 deaths of children. They actually came to the hospital, what is referred to as dead on arrival. So before they actually got to the hospital, they were dead. And that's because they had signs and symptoms before, but I guess their caretakers, parents, probably did not interpret this as a serious disease, and therefore might have given the normal treatment. Unfortunately, when they decided to seek medical care, it was too late. But these cases, we have undertaken to investigate them because we want to prevent this from happening again. And we would be publishing guidelines to ensure that parents can understand when children get COVID, to make sure that they can come to the hospital in a timely manner.
Okay. Well, thank you, Dr. Anthony. That concludes our COVID-19 update for today, February 3, 2022. Thank you for being with us.
Thank you very much.